You got some crazy crap coming from Joe Biden and the left, and you got some more crazy crap coming from public health officials on the left saying this unbelievable statement here, which is for the last couple months, they've been saying social distance, wear a mask, blah, 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 blah. And then what happened? Oh, yeah. Social justice matters more. In this political article stating that suddenly public health officials say social justice matters more than social distance. Ah, thanks. I didn't know that. I didn't know the coof kind of went and left the window and went out the door. Whatever, it's gone now, right? Because social justice matters more now than social distancing. As seen by Governor Whitmer when she was repealing the licenses from people who want to get back to work, and then by not social distancing, and then her herself not social distancing any march wherever. Yeah, that's interesting. For months, health experts told Americans to stay home. Now, many are encouraging the public to join mass protests. Yeah. So what is it there, chuckleheads? Is it stay home or join the protests? Oh, wait, there is nothing in between? White coats for black lives. What a dipshit this chucklehead is. For months, public health experts urged Americans to take every precaution to stop the spread of the coof. Stay at home, steer clear of friends, batten down the hatches and the extended family, and absolutely avoid large gatherings. Until now. Now some of these experts are broadcasting a new message. It's time to get out of the house and join the mass protests against racism. Yeah, I always like to join protests who are throwing rocks and bottles and pipes and bombs at police and destroying property that's not yours. Yeah, that's always a good thing to do because I really want to get involved in that, especially when for the last 4 frickin' months you've been harking on this. Stay home, stay safe. But now it's okay because there's a political message out there that you may try to pin on the president. Interesting. Let's read from this stellar frickin' brainlet over here. We should always evaluate the risks and benefits of efforts to control the virus. Jennifer Nuzzo, a Johns Hopkins epidemiologist, tweeted on Tuesday. Oh, here comes, boys and girls. In this moment, the public health risk of not protesting demand and into the systemic racism greatly exceed the harms of the virus. Ah, that's interesting. So the virus knows that if you're out there protesting, it won't infect you. But if you don't, it's going to infect you. Is that what you're saying there, Jennifer, you dipshit? The injustice that's evidence to everyone right now needs to be addressed. Abrar Karan, a Brigham and Women's Health physician who exhorted coronavirus experts to amplify the protests' anti-racist message. Yeah. Imagine if you tell a black person to kneel with you as you kneel. You're racist because you told them to kneel. Only white people have to kneel because 400 years of blah, blah, blah. Notice I was born in the middle 70s and somehow I'm responsible for it? Bull effing crap, you dingbats. While I voiced concerns that the protests risk creating more outbreaks, the status quo wasn't going to stop COVID-19 either, he wrote. While I voiced concerns that the protests risk creating outbreaks, the status quo wasn't going to stop. Oh, so it didn't matter. What you're saying is that the status quo isn't going to stop it, so just go out and protest. You're still gonna get hit. Kind of like what I've been saying over the last 3 months. You're gonna get it eventually. I see. Continuing on here, its message echoed by media, left-wing outlets, and some of the most prominent public health experts in America, like former Centers for Disease Control and Prevention Director Tom Frieden, who loudly warned against efforts to rush reopening, but is now supportive of mass protests. Well played. Their claim, this has got to be good, if we don't address racial inequality, it'll be much harder to fight COVID-19. There's also evidence that the virus doesn't spread easily outdoors. Oh, especially if people wear masks. But wait a minute. I just had an article back on May 21st saying that even if you wear a mask, it doesn't really help. You still have to maintain distance, but even then it may take 4 minutes, 5 minutes to half an hour to actually contract the virus. So which is it? Public health experts. Which is it? Can you get it without wearing a mask? Can you not get it without a mask? Is it symbolic? Is it not symbolic? You see, there's mixed messages here, boys and girls. Of course there is, because the virus wasn't as bad as people thought. Now the truth is coming out. How about that? Oh God, as I say that, the experts maintain that their messages are consistent. Really? I just read that they've got conflicting messages. Now they're saying, oh, no, they're consistent. That they're always, we're always flexible on Americans going outside. Oh, then why didn't you say it before? That they want protesters to take precautions. And they're prioritizing public health by demanding an urgent fix to systemic racism. Let me tell you something there, folks. The virus doesn't care if you're racist, black, white, brown, green, blue, yellow, purple, LGBTQP2+. They don't care. The virus doesn't give a crap. It'll infect your ass, so it doesn't matter. But no. They're not sending mixed messages here. They're saying, we should get out now. But not your business. No. Protest, but not open your business. I see. The plot thickens. But their messages also are confounding to many who spent the spring strictly isolated on the advice of public health officials, only to hear that they might not to be so absolute after all. It's particularly nettlesome to conservative skeptics of the all-or-nothing approach to lockdown who point out that many of these same public health experts, a group that tends to skew, is liberal, widely criticized activists who largely held outdoor protests against lockdowns in April and May, accusing demonstrators of posing a public health danger. Oh, I see. Conservatives who felt their own concerns about long-term economic damage or even mental health costs of lockdown were brushed aside, just as days or weeks ago, are increasingly asking whether these public health experts are letting their politics sway their health care recommendations. Hey folks, come here. Get close. Come here. Yes, that is correct. Their politics are swaying what they're saying to you and what they're recommending. If you don't know that now, then you're not very smart. Their rules appear ideologically driven, as many people can only gather for purposes deemed important by elite central planners. Brian Blasey, who worked on the health policy for Trump administration, told me an echo of complaints raised by prominent conservative commentators like J.D. Vance and Tim Carney. Never heard of them. Conservatives also seized on a Twitter thread by Drew Holden, a commentary writer for former GOP Hill staffer, comparing how politicians and pundits criticized earlier protests but have been silent on the new ones or even championed them. I think what's lost on people is that have been real sacrifices made during lockdown. People who couldn't bury loved ones, small businesses destroyed. How can a health expert look at these people in the eye and say it was worth it now? Some members of the medical community acknowledge they're grappling with the U-turn in public health advice too. It makes it clear that all along there were trade-offs between details of lockdowns and social distancing and other factors that experts previously discounted and even decided to reconsider and rebalance. You see, they will reconsider and rebalance only if it's ideologically left. That's it. If you're on the left and you're protesting, good. If you're on the right and protesting, bad. Imagine my shock. Oh my God. Flyer pointed out the protesters are also engaging in behaviors like loud singing in close proximity, which the CDC has repeatedly suggested could be linked to spreading the virus. So they're telling you to go out to protest, but they were telling you earlier, if you're protesting, you're killing Granny. Skews left, doesn't it? At least for me, the sudden change in views of the danger of mass gathering has been disorienting, and I suspect that has been many for Americans, he told me. The shift in experts' tone is setting up a confrontation amid a backdrop of a still raging pandemic. Tens of thousands of new coronavirus cases continue to be diagnosed every day, and public health experts acknowledge that more will likely come from the mass gatherings sparked by the protests over George Floyd's death while in the custody of Minneapolis police last week. As I said, the virus doesn't care about the nature of a protest, no matter how deserving the cause is, Holden said. Again, as far as I can tell, all this lockdown crap was to destroy the economy, and in my opinion, to sway the election in November 2020. It may have worked. It may have not. But what we see here is that these public health experts are far left. Far left. If there's anybody on the right, I don't know them. I don't know who they are. Matter of fact, remember when YouTube, Susan Wojcicki, remember this? You got rid of those doctors that said, this is not as bad as we say. Bam, they're gone off YouTube. Why? Because it went against the narrative. Now, we got protesters going against the narrative, and then the left saying, no, it's cool. As long as you practice social distance. You ever try to social distance in a freaking riot? Impossible. So now everything is hunky-dory as long as you protest the right way. Protest and violence and looting, that's the right way according to these public health experts. But if you're going to a state capitol, not looting, promoting your Second Amendment rights and First Amendment rights, that's bad. And you're trying to kill Granny. I see now. All politics, all the time.